Review of allergic reactions to weight loss medications. Now, currently there's a lot of GLP-1 medications on the market, most commonly used for diabetes and often used for weight loss as well now. And while we are using class effects, certain medications might have different types of manifestations of possible allergic reactions. By far, the most common allergic reaction is a large local reaction, meaning the injection site turned red and it's pretty itchy, but it stayed where the medication was injected. Now, since these medications are peptides, this would be expected, and almost all the different brands have this manifestation. It appears anecdotally, meaning just from doctor experiences, that it might happen a little bit more commonly with Mounjaro, but it is well documented with semaglutide as well, and really well documented with Saxenda or liraglutide because that's the oldest of the medications. Now, it depends on your doctor, but for the most part, this is not a reason to have to stop the medication, and usually it can be treated with an over-the-counter hydrocortisone cream after the injection. Systemic reactions have also been observed, most commonly case reports to liraglutide, and they're hard to catch sometimes because these medications might be injected and might peak later in the day. So a person might have like recurrent hives or angioedema, and the only way the doctor knows that it was an allergy to liraglutide is they stop the medication and the reaction subsides over a period of time. It's most commonly described in case reports with liraglutide, and there is one or two case reports with semaglutide, which is Wegovy or Ozempic. There aren't any case reports right now that I could find for Mounjaro. I have never seen an allergic reaction to any of the medications except for semaglutide. I've seen one case of swelling of the lips maybe 3 years ago, and I do see large local reactions to semaglutide quite often, which usually patients do not stop just for that, as long as it doesn't leave the injection site. If it leaves and they start developing rashes other places, then we stop the medication. This is a morbilliform rash. This is a common reaction that occurred. Lots of different meds can cause this. Antibiotics can cause this very commonly. But this has also been seen with semaglutide, where a person has this red rash. This is different than hives because it's not moving and the itching doesn't really go away. The rash doesn't really go away with antihistamine, but this is a sign that it could be a drug reaction, and typically this is a case to stop the semaglutide. Right now, based on case reports, it does not appear that the different ones are cross-reactive. So those who did not tolerate liraglutide due to an allergy did tolerate semaglutide. And it's unclear about tirzepatide because that has not been on the market long enough yet. This is the side effects from the trial using adolescents, which usually have a little bit more sensitive skin. And there was no reports of hypersensitivities in these individuals, and no reports of large local reactions as a main side effect, indicating that overall skin side effects to these medications is quite uncommon. I see it more commonly because I'm an allergist, and anaphylactic or angioedema is extremely uncommon because of how often these medications are used, but how little case reports there are about these hypersensitivities. So in conclusion, if there's a large local reaction to the injection site, talk to your doctor about it. It might not be a reason to have to stop the medication, and it might not occur if you use a different brand. If you have a systemic where the rash is coming all over the body, then it's a form of concern, and then you should see an allergist and discuss that with an allergy doctor. Okay, I hope that helps.